Hey guys, how's it going? It's Dr. Brian Adkins with the Adkins Academy. Just want to go live and go over some questions and just some topics. We've had a lot of great responses on our YouTube channel, as well as our Instagram and Twitter pages. Would love to hear more of your comments and certainly have you answer several of our questions that we've posted on our Facebook page and our Twitter page and our Instagram page. Love hearing your responses. But also have had a lot of people to call me and wanted to go over some additional questions and additional topics. So if there's anything that you'd like to go over, I'm happy to go over and talk about it and kind of really help you to integrate your knowledge. And so take that basic science to clinical and help you to really integrate your knowledge when it comes to that. And so whether we're talking about the TEAS test or the NCLEX exam, we can kind of mirror a lot of our merge, I should say, a lot of the information to make sure that you understand how to apply your knowledge, not only for the TEAS test or the HESI exam, but also in your A&P class that you're doing right now, but also in nursing school and obviously in preparation for the NCLEX. So we try and give you that entire spectrum of knowledge and information and help you to apply it. That's really what this is all about. It's not just memorization, but it's really about helping you to understand it and apply it and understand how this relates to that, right? That basic cell biology relates to anatomy and physiology, which relates to the drugs that you're giving on the wards, right? And so so we try and really give you that big picture, okay? So I just finished up an English class. We have our classes on Sundays and Wednesdays for the TEAS and HESI program. So I just finished that. I just wanted to just get on really quickly and go over some of our questions, question of the week from last week, and then just go over some additional just kind of material with you guys. So yeah, definitely chime in, definitely comment. If you have any questions or comments along the way, happy to answer any of your questions and certainly go through. Thanks a lot for chiming in. I see you there. Yep, perfect. All right. Thanks a lot. Yep. All right. Good to see you too. All right. So let's go ahead and get started here, and I'll just turn the camera around so you can see our question, and we'll kind of use this as a springboard to go over some other concepts and some things that we talk about during our classes. Okay. And so let's take a look at this question here regarding and related to the parasympathetic nervous system and the sympathetic nervous system. And so in particular, which of the following can be excluded as a major function of the parasympathetic nervous system? And so when we talk about parasympathetic, we got to think parasympathetic versus sympathetic nervous system, right? And so do you have a clear understanding of parasympathetic versus sympathetic, right? Those are very, very big components in terms of the nervous system, but also in terms of the test, and that, things that they definitely want you to know and understand when it comes to the TEAS test, but also the NCLEX exam. And so you certainly want to understand, the nervous system. So let's just do a brief overview here and a quick overview and talk about it, and then we'll go back to our question here. So if we take a look at this, then we got to understand in terms of the nervous system. I'll just draw on the whiteboard. But in terms of the nervous system, we have make this a little bit bigger for you. But in terms of the nervous system, we have the nervous system in general. We have the central nervous system and the peripheral nervous system, and the central can be broken up into the central nervous system of the brain and the spinal cord. Okay, now part of the brain, you also have those 12 cranial nerves that you have to take into account as well, right? And so you have to make sure that you know and understand those 12 cranial nerves, so 1 through 12. And so the cranial nerve is not a hard thing if you actually just think about it in terms of for example, a physical exam here, right? And so if you thought about it in terms of a physical exam, here are the 12 cranial nerves. And so with that, when we talk about cranial nerve number 1, we're talking smell and olfaction, so the olfactory system there, right? And so olfaction and olfactory. Cranial nerve number 2 is going to be the optic nerve, so we're talking vision, right? So vision. So you definitely want to know the location where the visual fields are and vision is interpreted. And so at that point, we're talking the visual cortex, and that's going to be the occipital lobe, right? So make sure that you know the different parts, so temporal lobe, occipital lobe, frontal lobe, parietal lobe, all those different things. Hey Susan, good to see you. Yeah, great. So definitely understand 3, 4, and 6. These are all associated with motor to the eye. Okay, so 3, 4, and 6 are motor to the eye. Okay. And so with that, definitely know motor to that is going to be 3, 4, and 6. Cranial nerve number 5 is going to be really touch to the face, and so vision. And so that's where touch to the face. I'm sorry. And so that's where we talk about the trigeminal nerves. So V1, V2, and V3. And so this is going to be V1 here, V2, and then V3 here. Okay, and so so when the dentist numbs the gums, right? Then we're talking mainly V3, and that's giving you a lot of that with the mandible, and so really numbing those nerves. Yep, absolutely right. So 12 cranial nerves. And then cranial nerve number 7, or cranial number 5. It'll stick with that. It's also going to be for motor to the muscles of mastication. So your ability to chew in the temporalis muscle as well. Okay, and so a lot of you have asked me to go over these. So I want to definitely go through this a little bit more with you. But in terms of some of the other cranial nerves, cranial nerve number 7 is going to be the facial nerve, and so the facial nerve is going to control a lot of the those motor functions to the face. So we think of 5 as more touch to the face, whereas 7 is more motor to the face. And so with that, we're talking your ability to frown, your ability to smile, those types of things. And so there we go down there. Okay, got it. Yep. All right. So the facial nerve, and so really motor to the face. And so a lot of those emotional expressions that you see in terms of people who can wiggle their nose and things like that, that's a lot of cranial nerve number 7. So that's going to be the facial nerve. Okay, and so cranial nerve number 8, let's go there. That's the vestibulocochlear nerve. That's going to control a lot of the ability to hear, obviously, which you can hear me now, so you can hear. And so if you walk into the room, you see your patient can certainly not only see you but hear you. Then cranial nerve number 2 is working. Your patient is able to move his or her eyes right or left. Then up, down, and you kind of look at those visual fields. You test those different visual fields. Then we know that 3, 4, and 6 are working as well. Your patient is able to smile at you and move things around on their face. Then you're thinking, okay, well, cranial nerve number 7 is working as well. So just by walking in the room and seeing your patient, a lot of times you can actually tell a lot of these things are working. And so obviously you still want to test these things and make sure that you test your patient's ability to do all of these things. But you can see, for example, we talk about a disease like Bell's palsy, where you have hemi-sided kind of paresis, and so where one side of the face may be paralyzed and the other side of the face is working, right? So that's when we get into, okay, well, what's going on with one side of cranial number 7, right? For example, okay. But we also have, like I said, cranial nerve number 8. Let's go back to that. That's hearing, but also your ability to sense acceleration, right? And so if you're in the car and you can feel that acceleration, that's cranial nerve number 8, right? And so that's the vestibular part, right? Cochlear is the hearing. Vestibular would be the balance part, right? So your ability to maintain your balance. Now, cranial nerve number 9 is going to be the glossopharyngeal nerve. Here is going to control the sensation to the back of the tongue, and certainly the throat and the pharynx, and so hence glossopharyngeal nerve. And so that gag reflex, and so someone who is intentionally vomiting, right, by sticking their finger down their throat, that kind of thing, that's cranial nerve number 9, so that gag reflex. Cranial nerve number 10 controls a lot of homeostatic functions, so that's called the vagus nerve. And so we're talking certainly respirations and GI activities, liver activity, lung activities, those types of things. And so cranial number 10 is involved in a lot of different things, and in fact the parasympathetic nervous system, which we'll get back to that in a second, certainly uses a lot of the vagus nerve innervations to do its thing. Okay, and then cranial nerve number 11 here is going to be the spinal accessory nerve. So certainly controls the muscles of the neck and back, and so your ability to move your head left or right, your ability to shrug your shoulders up or down. We're talking the accessory nerve, cranial nerve number 11. And then the hypoglossal nerve, cranial nerve number 10, is going to control the your ability to talk. So if your patient is talking to you and your patient is actually engaging with you and talking to you able to hear you, but also also produce speech, right? Then cranial nerve number 12 is working in terms of being able to move the tongue left, right, up, down, and certainly the maneuvers that are needed for a patient to actually speak. There's a lot that goes into that, especially with the tongue. And so if your patient is speaking to you very well, then that's likely an indication that cranial nerve number 12 is working just fine. So hopefully that's helpful in terms of giving you some perspective in terms of the cranial nerves. Obviously with strokes and things like that, a lot of these cranial nerves are going to be affected. And so we talk about Wernicke's and Broca's areas and in terms of speech areas. You'll learn more about that in nursing school. But certainly if a patient is unable to actually produce speech or even hear speech because after a stroke, then these cranial nerves and these areas of the brain may also be affected as well. And so, depending on the location of the stroke, that can give you a sense of what's going on, right? And so, and what, I should say, depending on the deficits that the patient has, can give you an indication of where the stroke may have happened as well. So, again, that gets into there's a lot of other aspects of things, but let's go back to this and understand where we are in terms of the parasympathetic nervous system. That's where we really want to go. So I just wanted to give you some anatomy in terms of the central nervous system and the peripheral nervous system there. But now let's go over to the peripheral nervous system here. And so the central nervous system, brain and spinal cord, the peripheral nervous system, this is where we get into over here, what we're talking about with our question. This is where we get into, sorry for the back and forth there. All right, so this is where we get into the somatic nervous system and the autonomic nervous system. Right, and so in terms of the somatic, we're talking the skeletal muscles, and so this is the voluntary. So the voluntary nervous system. So the voluntary system here. Right, and so our ability to control our muscles, right, control our the way we walk and the way we talk and the things that we do. Whereas the autonomic nervous system, that's where we're getting into parasympathetic and sympathetic. And so we're talking more of a functional aspect of things as opposed to just a anatomical aspect. And so in terms of the autonomic, this is going to be involuntary. So involuntary. Okay. All right, thanks a lot for joining. I see you there. So involuntary, okay? And so in terms of parasympathetic, we should be thinking rest and digest. So rest and digest, right? And so we're thinking rest and digest. If that doesn't work for you, think paralysis, right? And so parasympathetic, paralysis, right? And so rest and digest. And so this is going to be a cholinergic system, so using acetylcholine, okay? And so... all right, and so okay, and so we're definitely thinking rest and digest using the acetylcholine here. All right, and so we're thinking building, right? And so this is where we're talking about building, right? And this is where we build so building muscles, so resting, and as we're resting, we're replenishing our energy, so increasing our energy levels and increasing our energy storage, right? And so increasing our energy storage with the parasympathetic nervous system, right? And so this is where we also, with the parasympathetic nervous system, we're going to have dilation of the pupils. We're gonna be able to see see farther and be able to constriction of the pupils. Sorry, the thing is sympathetic there. We want constriction of the pupils. We want to be able to close our eyes. Sorry about that. We're going to close our eyes. We want to rest, right? So we're thinking rest and digest. We want to kind of close the pupils and kind of get to resting. Okay, I got it. All right, and so sorry, I got a bunch of distractions there. But kind of resting, and we're thinking about eating and hunger and fulfilling those types of needs, but also urination and defecation, fulfilling those types of needs when we talk about parasympathetic nervous system. Okay, and so on the other hand, we talk about the sympathetic nervous system. That's going to be the fight or flight system. So the fight or flight. Okay, so fight or flight system. Okay, and so with that, so the sympathetic nervous system uses norepinephrine, so it's the adrenergic system. And so we're thinking action, right? So we're thinking a situation that we need to respond to, so certainly understand that aspect of things, and so that's where we have pupillary dilation. So sorry about that. Sorry, I got a phone call coming in. So pupillary dilation, we want to see farther, right? Whereas rest and digest, we want to kind of constrict our pupils and be able to go to sleep, right? So we those types of things, okay? And so all right, so certainly understand those things. And so if we go back to the go back to the question here, if we go back to the question here, then what we can see is which of these, and what the question is asking us for is which of these is most associated with the parasympathetic nervous system. So protection of the retina with excess light exposure, right? Increase net energy exposure, and so are we going to increase our energy, or are we going to decrease our energy with the parasympathetic nervous system? Are we going to reduce the activity of the heart? Are we going to increase the activity of the heart? Right? Are we going to have hollow organ evacuation? And so, for example, the bladder would be a hollow organ, but also the large intestines, right? The GI tract in general. So the hollow organ. So again, we're going to increase urination and defecation. We're going to reduce the activity on the heart, and so sympathetic nervous system should increase the heart activity pretty significantly. Okay, and so an increase in net energy expenditure. So there wouldn't be an increase in net energy expenditure, but instead there should be a replenishing of the energy, right? And so increase in net energy gain and increase in net energy restoration, right? And so we're going to definitely protect the retina from excess light exposure by decreasing the size of the pupil, so constriction, so pupillary constriction. Okay, and so again, that's just kind of again part of putting it all together. But certainly the correct answer here is going to be is B, right? And so that's going to be the excluded, right? And so which of the following can be excluded as a major function of the parasympathetic nervous system? Certainly going to be that increased net energy expenditure. So that's where we get into the sympathetic nervous system, where there's going to be an increased net energy expenditure. Okay, and so just wanted to give you a sense of kind of again one of the questions that we've gone through for our question of the week, and wanted to also just give you a sense of also kind of just in terms of our energy expenditure, where's that coming from, and how does that work? And so a lot of people kind of think that this is more memorization, but I want to go through this just really quickly and help you to understand how this is applicable, okay, in terms of cellular respiration. So we talk about cellular respiration here, and so cellular respiration, a lot of the things that we break down, and so in terms of our ability to break down glucose, but also our ability to break down fats, also our ability to break down proteins. And so these macromolecules that we are breaking down, they have the ability to be broken down. So fats can be broken down via beta oxidation, right? And so oxidation, and so they're asking about that on a lot of these exams, but also proteins can be broken down as well. And so when we break down proteins in the cell, then we start to produce ammonia, and that ammonia then goes into the bloodstream, and then goes to the liver. And so when it goes to the liver, then the liver turns it into urea, right? And so that's urine. That's the ammonia plus water. And so that's where we get into our BUN levels, blood urea nitrogen levels. But again, you'll learn about those pathways there. But in terms of breaking down a lot of these things, they can be broken down into acetyl-CoA. Right, and so they go into the mitochondria, broken down into acetyl-CoA. Then ultimately they go through the Krebs cycle, and the whole purpose and the whole premise behind eating the glucose, eating the proteins, eating the lipids, and breaking these things down is so that we can ultimately increase this right here, which is our ATP. Right, and so we want to increase our ATP, and so if you want to better understand this and better get a more in-depth understanding of this and really understand it, not just memorize it, and understand the hows and the whys of it, then certainly feel free to reach out to us. I love talking to students, working with students, and helping you to understand how all of this is applicable to real life, and to how we utilize insulin and glucagon to either increase or decrease blood glucose levels. Why is it that we increase insulin levels? Why is it that we decrease insulin levels and increase glucagon levels, right? And so part of that has a lot to do with, again, our needs for our energy needs, okay? And so again, and we can kind of, again, relate this right back to parasympathetic and sympathetic system. And so if you're talking fight or flight, you need more energy. So you're going to increase that release of glucose. You're going to increase the breakdown of glucose because you need more ATP. Because again, without ATP, the muscles don't work, the heart doesn't work, the enzymes don't work, the transporters don't work, and again, you can't fight or flight, right? And so whereas the parasympathetic nervous system, we're thinking rest and digest, and that's where again we want to start to build. And so insulin would be more of an anabolic hormone that's helping to take the glucose from the bloodstream, put it into the cells, so you can continue to build and help build, right? And so again, all of that goes along with the parasympathetic nervous system, again with that rest and digest. And so again, this is just a short, kind of a short thing, but certainly if you want to learn more and understand more, and certainly understand how to put this all together and really get an in-depth understanding, and make sure that you understand how this is applicable to your patient, and how to apply your knowledge not only in real life but also on the test, with the TEAS test, the HESI exam, but also the NCLEX exam. Certainly feel free to reach out to us. Dr. Brian Adkins with the Adkins Academy. I talk to all of my clients and I help you to understand what it is that we do. How does it work, right? It's not just a book that you read out of or something like that. It's not just a question, it's not just some random kind of question thing online, right? And so, when we go through questions, we're going through questions that I've personally written from my experience of having gone through medical school, my experience of having worked with thousands of nursing students and medical students, and just students in general, helping them to understand the concepts and the content. So with me, you're not getting, just as I said before in other videos, just Joe Schmo the tutor, but you're getting someone who understands the entire gamut of these concepts and can help you to understand it, and not just memorize it, and how to really apply it. And this is not just for science, but also for English, for math, for reading, right? I'm expert at these concepts and at these topics, so that you can I help you to essentially do well on these standardized exams. Because at the end of the day, when it comes to a lot of these nursing schools, they're getting 500, 1,000 applicants, right, for 40 or 50 seats. You want to be one of those 50 people who get in. Well, if that's the case, you need to do well with your TEAS test or your HESI exam, right? And so a lot of the hospitals are offering almost astonishing salaries these days, right? And I'll just put up one on the board here. But this is a hospital in Florida, and it kind of cut off there. But registered nurse anesthetist, right? For the post anesthesia care unit, not even a nurse anesthetist, just a nurse, right? With the BSN degree, 73 to 113,000, right? And that's in Melbourne, Florida, right? We have another one here in Vieira Health Rehabilitation Center. They're offering $3,500 just as a sign-on bonus, right? We have another one here, medical management registered nurse, right? $61,000 to $103,000, and lastly here we have nurse for the emergency department. So Florida Hospital in Columbus, Florida, they're looking for nurses right now. I've talked to a lot of these recruiters and other people. They send me these things all the time, and so 65 to 105 with the cut off down here, but a $10,000 sign-in bonus, right? And so plus relocation, right? And so if you're looking to take your career to the next level, you really want to get into nursing, then certainly you may start with taking the prerequisites and taking the TEAS test or the HESI exam. And then if you've just finished, I know a lot of you are graduating from nursing school now. If you've just finished with nursing school and you need to take the NCLEX and you don't feel too confident, too prepared for it, we do have a class coming up May 21st, right, through June 27th. We can help you to prepare for the NCLEX. And so definitely reach out to me directly, 301-960-4950, and we can definitely help you to get your score where you want it to be, either for the TEAS or the HESI exam or for the NCLEX exam, and really pass that on the first time. A lot of schools are being reprimanded for not getting their students to pass on the first time. So you don't want to be one of those students. You want to make sure that you pass on the first time, and so we can help you to do that. We've helped literally hundreds and thousands of students to pass the TEAS test and the HESI exam and the NCLEX exams also. Okay, and so here's just one of the scores from one of our students performance recently, but notice that she went from a 54 to a 92 just recently here. And so notice that the national average for the TEAS test, here, the national average for the TEAS test is a 65, right? For the science section, which we're all going into a science discipline, is a 57.2. Right, and so again, you want to make sure that you are you're not in the 50s and 60s, but instead you're in the 80s and 90s. And if that's where you want to be, certainly reach out to us and give me a call so that we can help you to do that. Okay, and so like I said, with our course, you're getting a real instructor who understands the material, who can explain it to you, can put it together for you. That's what you need in order to do well. Okay, hopefully this was helpful. Like I said, I'm happy to take your questions, and you all can, as you know, can call me or text me or email me. All of my clients can, and all of my clients do that. But also, if you just want to leave a comment and there's another video or another topic that you'd like for me to go over and talk about, please do that. I'm happy to go over it and certainly address your particular concerns. All right, but we'll see you for the next live video, and you can also find us on YouTube. So if you just put in the Adkins Academy YouTube channel, you can actually see this video, but other videos that cover other topics from English to math to science to reading, but also clinical NCLEX type questions as well. And so definitely subscribe to our YouTube channel, and we'll see you for the next one. All right, thanks.